I would now like to welcome our next speaker, Dr. Yipeng Ji, who is a Chinese Canadian and a first-generation immigrant. He is a primary care doctor, also trained in public health. He received a Master of Public Health degree at the Harvard T.H. Chan School of Public Health. Yipeng is a board member of the Canadian Public Health Association, Canadian Doctors for Medicare, and Humanity at Luxem. He is passionate about tackling health and social inequities by addressing the social and broader determinants of health, including anti-racism work and practice in medical education. Yipeng has worked in various global health organizations, including the World Health Organization in Geneva and the Population Health Research Institute in Hamilton, Ontario. Yipeng is a strong ally who has walked the talk himself by going to Gaza to provide medical relief since October. Please help me in welcoming Dr. Yipeng to the stage.
Good evening. I'm very honored and grateful and privileged to be before you today to share some time and space with you and to be with you this evening, to be with such, amazing people, many who I've deepened relationships with over the past couple of months, and some who've I've met for the first time and have so many new amazing friendships. And so I'm so grateful to be here with all of you. But my heart is very heavy. And I hope to maybe share some of the realities of what this kind of like humanitarianism or humanitarian work looks like currently. But before I do want to share, I am a trained primary care doctor, but I've also been studying the structural determinants of health, including that of the impacts of settler colonialism and colonization on health and healthcare, in the context of the settler colonial state of Canada, but also in the context of occupied Palestinian territories and how it manifests through the ongoing Nakba as apartheid, occupation, and genocide. And it's from that experience of scholarship that has led me to bearing witness to occupation and apartheid in the context of Jerusalem, occupied West Bank, and historic Palestine. And when you bear witness to atrocities against humanity, as a human being, we have to do something. We have to do everything, actually, to call it for what it is and to practice meaningful solidarity, to put things on the line, to put things at risk, because the Palestinians that I've met in my travels, the privileged travels that I've had the opportunity to visit Palestine, when my own Palestinian colleagues, friends, and comrades do not have their right to return respected and granted. But that is the privilege and the discomfort that I will hold and will continue to allow myself to do everything I can within my power to stand in unwavering solidarity with the Palestinian people and their right to self-determination, liberation through resistance. I've had an intimate experience with anti-Palestinian racism, but the irony of having had that experience was that it deepened my understanding and connections to the cause, but also allowed me to have more time, space, energy to dedicate to the people that I love, to the cause that I am committed to. And it's through that experience that I met some amazing humanitarian healthcare workers that have practiced medicine, that have taught medicine in Gaza for many years. And so earlier this year in February, I had the privilege of going to work as a humanitarian healthcare volunteer. I worked at a primary care clinic called Tel Sutan Primary Clinic in central West Rafah. And the things that I saw there, bear in mind this was in February of this year, a couple months ago. The things that I saw there are medical conditions that I have never seen before in my medical career thus far. But I haven't been practicing for that long. I have practiced medicine in certain places in Canada, including in Nunavut, where I thought that was under-resourced. No, the things that I saw in Gaza in February were just so horrific that I had no other conclusion than this being an ongoing genocide, that this is forced starvation, that this is the systematic destruction and elimination of an entire population by the Israeli forces, by the Israeli Zionist regime that continues with such impunity. That same impunity that is perpetuated because of the actions of this current Canadian government through their policies, but they're also their rhetoric. The medical conditions that I saw in Rafah in February included many different kinds of infectious diseases. There was a UNICEF report at the time that said over 90% of children under the age of 5 having one or more infectious disease. Over 90% of children under the age of 5. And that's certainly what I saw. I saw children with different kinds of gastrointestinal infections, wound infections, skin infections, lung infections. The clinic that I worked at didn't even have antibiotics. We had to bring in a supply of antibiotics. We brought in 18 suitcases full of medicines and medical supplies and started prescribing them. But we learned from each other. The team that rotated out and replaced us, they brought in 50 bags of medications and supplies. This is not a solution, though. If we think about the context of the Gaza Strip and the 17-year blockade that existed, there was already a significant limitation in the humanitarian aid that was entering the Strip. There's something colloquially known as the Gaza diet, where the caloric intake of the entire population of the Gaza Strip has been limited so that Palestinians in the Gaza Strip can live, but they certainly cannot thrive. And so I already saw some of these patients who were stunted, physically stunted because of those impacts. But what was most horrific was, in my mind, sure, I would prepare myself with seeing patients with amputations, with lost eyes, being physically maimed, psychologically distressed from the airstrikes and bombings and constant drones that I heard all the time. But what was most horrific was the forced starvation, to be quite honest, was the severe malnutrition in the patients that I saw when, as a doctor, you have this perception that you can enter any situation with the knowledge and the skills that you have to do some good. But I was helpless looking after these severely malnourished children. I remember a child that came in the arms of his mother. He was about 9 to 10 years old. He wasn't walking anymore because of how severely malnourished he was. He hadn't been eating and drinking for 4 days because he'd been throwing up from a gastrointestinal infection. He was just skin and bones at this point. The World Health Organization instructed us to take an upper arm circumference measurement, which is where you take a piece of measuring tape and wrap it around the arm of the child to screen for severe malnutrition. We didn't have measuring tape, but I didn't need measuring tape for this child. I could wrap my entire index finger and thumb around the upper arm of this child and also the lower leg of this child. And we couldn't do anything for the child other than giving them some IV fluid. I pleaded with the local doctor, there must be something more we can do. They have to go to a hospital to be able to be refed, because when you're actually that severely malnourished, you need to be monitored to be able to have, the appropriate kind of proteins, carbohydrates, lipids, so that you don't actually do more harm to the body by giving solid food, even if there was any. But that patient was not an isolated patient. It became a pattern. I saw other patients that were walking before that are no longer walking because of severe malnutrition. I saw patients that should be walking at 12 months of age, 14 months of age. These are milestones where a child should be walking. They're not walking because of severe malnutrition. I learned, this is something that probably was a footnote on one of my slides in medical school. Haven't ever seen it in the context of anything that I practiced in Canada. Rickets disease. It's severe vitamin D deficiency, severe malnutrition to the point where your bones are not developing properly. We had seen 3 cases in the course of a morning. I think about how people talk about the number of deaths and how it's not accurate, and I agree. The number is so grossly inaccurate, so grossly undercounted, because the patients, because of the people who get counted as a number, and people are not numbers, right? There are so many stories that are not told that still need to be told. But to be counted as a death in Gaza, you have to have the privilege of dying in front of a nurse or a doctor in a working clinic or hospital. This is a significant thing because in the context of what's happening in the Gaza Strip, really since October, but this has happened before in the context of the Gaza Strip, where Israel targets hospitals and clinics, targets healthcare workers, but has escalated to an unprecedented, disastrous state where every hospital has become a target. Certain hospitals, like Al-Shifa Hospital, the main medical complex in the north, has been besieged twice. The steadfastness of Palestinians is something else, because even despite Al-Shifa being destroyed for a second time, scorched, I don't even know how the building's still standing. There's a documentary that actually came out today, or I think yesterday, by Al Jazeera. I watched it earlier today. It's a 40-minute documentary about the atrocities, the crimes, the war crimes that the Israeli forces are trying to hide at Al-Shifa Hospital in their raid in March of this year. The mass graves that were uncovered, and the healthcare workers, doctors, nurses that are singled out and tortured to the point of, forcing them to provide confessions of things that are just simply not true, and some who have been tortured to death, and some who have just been killed for not following instructions because they choose to stay back to take care of their patients. We've never seen this in any other context before. This level of destruction of healthcare, because where there's healthcare, there is life. And we know that Palestinians love life. I think it's important to share what's happened over the past couple of months, because the situation has gone from really bad, in occupied territories where the healthcare system in the Gaza Strip was not a perfect one even before October 7th. And for those months where the World Health Organization was coordinating to allow humanitarian aid workers to enter, which is how I entered in February, all this changed on May 6th, May 7th, when the Israeli forces forcibly took the Rafah border crossing, seized it, killed the workers at the border, and continued to occupy this border. This is a significant border crossing because this is how international healthcare workers were entering and exiting and bringing in medications and supplies in somewhat of a reliable way. Trucks were constantly being inspected with things being thrown out, trucks be asked to turn all the way back because they've had some kind of item like water bottles that they weren't taking in that day. But the people that were going in, my colleagues, were able to bring in medications and supplies in somewhat of an unrestricted way. But this has all changed since May 6th, May 7th. What subsequently happened was just no movement whatsoever for about a period of 2 weeks. And then additional negotiations happened with the Kerem Abu Salem crossing, which is in southeastern Rafah, bordering with historic Palestine or Israel. And then there was some movement, but this movement is entirely different now. There was more reliability, much more reliability with how humanitarian aid workers were able to enter with some kind of predictability with their timeline for entry and exit prior to May 6th. Now we're having one vehicle that seats about 20 to 25 people cross from Amman, Jordan, to checkpoints in historic Palestine, Israel, to Kerem Abu Salem. And it's that same vehicle that drops these 20 to 25 people off, and then 20 to 25 people hop on to exit out. This isn't happening every day. This has only started about 2.5 weeks ago, and there are continuous delays and cancellations because Israel continues to withhold necessary humanitarian aid to the Gaza Strip. People are not allowed to bring in medications and supplies anymore. This is like telling a surgeon who can be the best trained surgeon in the world to not have the appropriate tools to do their work. One of my Palestinian colleagues at the European hospital in Gaza, in Khan Yunis, puts it aptly. It's like telling a plumber coming to your house to fix an overflowing bathroom or washroom completely naked. You can have the skills and tools, and knowledge, but without the tools, you're limited in what you can do. There was someone who tried to bring in 2 suitcases full of medications 1.5 weeks ago on a Friday, going in through the Kerem Abu Salem crossing. The Israeli forces decided to continuously question them, ended up delaying the entire group because they're traveling in all one car, and collectively punished them all by sending them all back. And this makes it so that the people that need to exit can't exit, so they actually had to travel back to their accommodations, their guest houses, through Rafah in the middle of the night, which is incredibly dangerous. A few days ago, the World Health Organization gave direction because of the Israeli instructions that anyone who's entering should not have a first-degree or second-degree relative who is Palestinian or born on occupied Palestinian territory, because there's a fear of them not being allowed entry, which has happened, which unfortunately wastes a precious seat on this 25-seater vehicle. And there's also a fear that this international worker with Palestinian roots will not be able to exit because they will deny exit to someone who is Palestinian. And so when we think about the nature of humanitarianism or humanitarian work, this is a direct attack on the very concept of humanitarianism. Just yesterday, there were additional land, sea, and air attacks on Al-Mawasi area in West Rafah. This is a safe area that the World Health Organization actually tells international workers to stay. where my colleagues are currently staying. My international foreign colleagues are currently staying. So when Israel continues with this level of impunity, where are the sanctions? Where are the two-way arms embargoes? I think about what was happening prior to May 6th through the humanitarian corridor. It was kind of like a slow stream of water that was entering in terms of aid. Now, over the past 2.5 weeks, after the tap was entirely closed off, now it's just droplets, mere droplets of aid. But what we know Palestinians in the Gaza Strip need is a tsunami of humanitarian aid. I will wrap up by sharing my colleagues. I'm part of a group called Health Workers Alliance for Palestine, and I have colleagues who I'm in touch with right now who are working at Al-Aqsa Hospital, Al-Auda Hospital, both in the central area and Deir Bella. And everyone is so deeply concerned with these sustained attacks on healthcare and the humanitarian corridor, which is basically shrunk to something that is not even meaningful to call a humanitarian corridor. But there's going to be an open letter where I hope the decision makers in the room can also commit to some of these things that we'll be calling for. The letter is titled Open Gaza, Resume the Flow of Critical Supplies and Personnel into Gaza. I won't read the whole letter, but at the end we say, despite escalating worldwide calls to end the genocide and allow the unrestricted flow of emergency support into Gaza, there are currently no plans in place to resume routine flow of essential medical supplies and healthcare workers into Gaza, nor to permit evacuation of the over 13,000 as of today, awaiting emergency medical transfers. We call on the Canadian government to use every available means at their disposal to pressure Israel to, 1, immediately open the Rafah and other land crossings to resume the flow of essential life-sustaining materials, including food, water, fuel, essential medical supplies, and personnel in and out of Gaza. 2, resume unrestricted patient transfers for life-saving and urgent medical care outside of Gaza. And 3, resume regular staffing rotations in and out of Gaza for international humanitarian teams. But with this said, there is no humanitarian solution to what's happening in Gaza. Let me make that entirely clear. It is a political solution. The people of Gaza, the people of Palestine, ultimately will free themselves. What we're seeing here is that Palestine and Gaza are freeing us before we can help free it. I read something a couple of months ago that goes like this. Someone said, Palestine and Gaza are splitting the left. No, Palestine and Gaza are defining the left. Here and now we're seeing truly who actually care about human rights, dignity, justice, peace in this world. It's you in this room. So I truly hope, moving forward, each and every day, we stand in unwavering solidarity with the Palestinian people in their struggle and fight for self-determination and liberation as indigenous peoples in their territory. Because for us to do this work, it means to free all oppressed peoples in this world, recognizing the overlapping crises and structural oppressions that exist that manifest itself as the question or the issue of Palestine. And so I hope all of you can continue to think about how will you step into your power so that you can more meaningfully commit to the solidarity work that will ultimately free all of us from these systems of oppression, that of Western imperialism, Zionist settler colonialism, capitalism. We are in the belly of the beast. When I was in Gaza, I was trying to enter Gaza, I forgot to mention, during the month of May, hence why I know the details of the restrictions, and I was in a holding pattern. Why I wanted to go back to Gaza in some ways was entirely a selfish one. Because when I'm there, it's healing. There is a sense of deep community and care and love and compassion for one another that unfortunately I do not see here in Canada all the time in all spaces. Not in my academic institutions, not in our professional medical institutions, but it's up to us to change that. Thank you.